Welcome to SATU Career 2.0 online nursing channel. For the past 10 days, we were very busy with our research activities so that we could not make any new videos for RRB recruitment staff nurse exam and MRB staff nurse exam Tamil Nadu. In today's video, I brought 30 questions from cardiovascular system which can be useful for those who are preparing for RRB and MRB staff nurse exam 2019. Before going to see today's video, please subscribe to our channel and click the bell icon to get the latest notification about new videos. Let's go to the first question of this video. Examination of a patient in a supine position reveals distended jugular veins from the base of the neck to the angle of the jaw. This finding indicates option A, decreased venous return, B, increased central venous pressure, C, increased pulmonary artery capillary pressure, option D, left-sided heart failure. So read the question carefully. We are examining the patient in a supine position which reveals distended jugular veins. Distended jugular vein indicate which finding? The right answer, option B, distended jugular vein indicates increased central venous pressure. The rationale, jugular vein distension is a sign of increased central venous pressure. While you are lying down on an exam table with the head of the table at 45-degree angle and your head turned to the side, your doctor will measure the highest point at which pulsation can be detected in your internal jugular vein. The internal jugular vein is more reliable than the external jugular vein because the internal blood vessel is in more of a direct line to the right atrium. The right atrium is the chamber of the heart that receives blood from the vena cava. So this is the rationale for this question. Question number 2. A cardiovascular nurse reviews recommended activities with a patient who sustained a myocardial infarction. The patient states, "It doesn't really matter what I do or don't do. I will either get better or die." This statement reflects option A, acceptance of changed health status, B, an internal locus of control, C, feeling of loss of control, option D, projection. The patient says, "It doesn't really matter what I do or not do. I will either get better or die." So this statement indicates patient is out of control. So option C, feeling of loss of control, is the right answer for this question. Question number 3. A patient who is in the 10th week of outpatient cardiac rehabilitation continues to exhibit symptoms of depression. When developing a discharge plan, the cardiac vascular nurse includes option A, a referral for counseling and possible medication, option B, a trial of herbal remedies, option C, alternative therapies including yoga and massage, option D, comprehensive information about the patient cardiac status to help reduce his or her anxiety. So here, a patient who is in rehabilitation at the 10th week of outpatient service exhibit the symptom of depression. So for any depression client, the nurse's role is to refer for a counseling. And sometimes if counseling is not going to be effective, we need to give antidepressant drug to treat depression. Sometimes both are given together. Question number 4. When reviewing a patient's 4-week diet history, a cardiovascular nurse identifies a pattern of high calorie intake on Monday, Wednesday, and Friday nights. The patient states that the patient's spouse recently started taking a night class on those evenings at a local university. The patient's diet history indicates option A disabling family coping behavior, B, a lack of dietary instruction, C, a need for cooking classes, option D, an individual coping behavior. So here, when you collect Dietary history. Patient says that her spouse goes for night classes during Monday, Wednesday, Friday. During these days, the patient's having high calorie intake at night. So what it indicates? It indicates the family coping behavior is disturbed. So option A is right. When the spouse of the patient goes for the classes, he could not cope up with the diet. So option A is the right. Question number 5. Which is the primary consideration when preparing to administer thrombolytic therapy to a patient who is experiencing an acute myocardial infarction? Option A, history of heart disease. B, sensitivity to aspirin. Option C, size and location of the myocardial infarction. Option D, time since onset of symptoms. So, while administering thrombolytic therapy to a patient who is experiencing acute myocardial infarction, what is the primary consideration of a nurse? The primary consideration of a nurse is to see the size and location of the myocardial infarct. So according to that, the dose of the thrombolytic agents will be differs. Question number 6. A 55-year-old patient who is diagnosed with an evolving myocardial infarction insists on going home. The cardiovascular nurse encourages the patient to be admitted because the greater risk within the first 24 hours of sustaining an myocardial infarction is option A, heart failure, B, pulmonary embolism, option C, ventricular aneurysm, option D, ventricular fibrillation. So here the case 55-year-old client diagnosed with an evolving myocardial infarction, so it is progressing. So patient is insisting to discharge and patient wants to go home. So the nurse encourages the patient to be get admitted and take treat so that the risk of which problem will be minimized. So the right answer option D, ventricular fibrillation risk will be minimized in the first 24 hours of a client sustaining a myocardial infarction, because we have two types of complication in the first 24 hours, that is immediate complication and late complication. So immediate complication includes heart arrhythmias like ventricular fibrillation, atrial fibrillations, and acute heart failure is the second leading cause complication in the immediate, and cardiogenic shock and mitral regurgitation are the other types of immediate complication. The late complication includes Dressler syndrome, which includes fever, pancreatitis, and inflammation of the lungs. Also, there is a chance of chronic heart failure. So here the patient is advised to prevent the complication of heart arrhythmia, that is ventricular fibrillation, or sometimes there may be chance of atrial fibrillation too. So option D is right. Question number 7. A primary prevention for reducing a female patient's risk of developing coronary heart disease is to option A, avoid excessive weight gain during pregnancy. B, enroll in a cardiac rehabilitation program. Option C, take 50 milligram of aspirin daily. Option D, take nitroglycerin at the onset of chest pain. So one of the risk factor the patient will have during the time of pregnancy will be that which can increase the coronary heart disease rate is the factor weight. So any excessive weight during pregnancy can predispose to coronary heart problems. So as far as possible, encourage the patient to maintain a regular weight during the time of pregnancy. Question number 8. Excessive alcohol use while on warfarin commodine therapy leads to option A, decreased anticoagulation effect, option B, decreased international normalized ratio, option C, increased anticoagulation effect, option D, increased vitamin K absorption. So excessive alcohol intake will interfere in which of the following effects when the patient is under warfarin coumadin therapy? So the right answer is it will decrease the anticoagulation effect. Excessive alcohol use at the time of warfarin therapy will decrease the anticoagulation effect. The reason alcohol is a blood thinning agent. So when you take along with the warfarin therapy, the blood thinning effect of this alcohol will decrease the anticoagulation effect. Drinking alcohol has effect on blood coagulation. You should abstain from alcohol while taking anticoagulant blood thinners such as coumadin, warfarin, as the blood thinning effects of alcohol can interact with those of the prescribed drugs. Move on to question number 9. A patient who is recovering from a myocardial infarction may benefit from meditation because this technique, option A, it decreases sympathetic nervous system activity, option B, decreases vasodilation, option C, increases sympathetic nervous system activity, option D, increases the release of catecholamines. So patient who is having myocardial infarction gets benefit from meditation because the meditation will decrease the stimulation of sympathetic nervous system. We know that sympathetic nervous system stimulation can increase the various activities like heart rate. So when you do yoga, that decreases the when you do meditation or yoga, that decreases the sympathetic nervous system. Automatically, we get the rest. When the sympathetic nervous system is stimulated, the activity is decreased, the parasympathetic activity will automatically increase, which gives the rest. Question number 10. A nurse is performing an abdominal exam and notices a strong pulse in the abdomen just above the umbilicus. She is most likely palpating what blood vessel? Option A, the femoral artery, B, the inferior mesenteric artery, option C, the abdominal aorta, and D is the external iliac artery. So while performing abdominal like exam, the strong pulse is felt in the abdomen just above the umbilicus. So it means the nurse is palpating the abdominal aorta. Option C is right. The rationale, the nurse is most likely palpating the abdominal aorta. This vessel is large, generally 2.5 to 4 centimeter in diameter, and a strong pulse can often be felt on palpation. The femoral artery is also an area where a pulse may be felt, but it is only palpable in the mid-inguinal point of the inner thigh, not in the abdomen. The exterior iliac artery branches of the abdominal aorta below the umbilicus, so it is not the right answer. And the inferior mesenteric artery is a minor artery and is generally not palpable on examination. So we come to know that the pulsation felt in the abdomen above the umbilicus will be from the abdominal aorta, which is generally 2.5 to 4 centimeter in diameter. It's the biggest diameter among all other blood vessels. Question number 11. Which of the following causes the S1 heart sound lub? Option A, the opening of the tricuspid and mitral valve. B, the closing of the aortic and pulmonary valve. Option C, the opening of the aortic and pulmonary valve. Option D, the closing of the tricuspid and mitral valve. So S1 heart sound is caused due to the opening of the tricuspid and mitral valve. Tricuspid and mitral valve opening causes S1 heart sound. The explanation, the S1 heart sound, sometimes referred to as lub, is caused by the sudden snapping shut of the tricuspid and mitral valve during systole. When the heart contracts and tension on the chorda tendineae is released, no sound is produced on the opening of these or any other valves in the heart. Question number 12. A patient has a 49-year history of hypertension. Which part of the heart would be most enlarged on the echocardiogram? Option A, left atrium, B, right atrium, C, left ventricle, D, right ventricle. So in hypertension, the echocardiogram shows the enlargement of the left ventricle. The rationale behind is the left ventricle is the most commonly enlarged heart structure seen in chronic hypertension. The left ventricle must overcome the afterload of the arterial system by becoming hypertrophied. As a result, the heart gets remodeled to overcome the systemic high blood pressure. The left ventricle directly pumps blood from the heart to the systemic circuit. Question number 13. What's an important teaching point for the patient receiving heart transplant? Option A. He will need to stay indoors during the winter months. Option B. He will need to take immunosuppressants for at least 6 months following surgery. Option C. He will be at risk of life-threatening infections because of the medications he will be taking. Option D. After 6 weeks, he will no longer be at risk for rejection. So, which is an important teaching point for the patient who receives heart transplant? It will be option C. He will be at risk for life-threatening infection because of the medication he will be taking. The rationale behind this answer: after a heart transplant, the patient is treated with potent immunosuppressants. The resulting immunosuppression puts him at a risk for life-threatening infections. Question number 14. Chest pain is described as pleuritic when it, option A, resolves with sublingual nitroglycerin, option B, occurs only during sleep, option C, increases with deep inspiration and decreases with expiration, option D, resolves with a deep breath. Chest pain is described as pleuritic when it is increases with deep inspiration and decreases with expiration. The rational pleuritic pain increases with deep inspiration and decreases with expiration. This is the basic explanation for pleuritic pain. The characteristic of pleuritic pain increases with deep inspiration and decreases with expiration. Question number 15. Vegetation on the heart valve results from option A, bacterial invasion, B, hypertension, C, poor diet, D, diabetes mellitus. Vegetation of the heart valve results from option A, bacterial invasion. The rationale: bacterial invasion produces vegetative growth on the heart valves. This growth may embolize to spleen, kidneys, central nervous system, extremities, and lungs. Question number 16. In atrial flutter, the key consideration in determining treatment is the option A, atrial rate, B, ventricular rate, C, configuration of the flutter waves, option D, PR interval. In atrial flutter, the key consideration in determining the treatment is the ventricular rate. Option B, ventricular rate. The rationale: if the ventricular rate is too fast or too slow, cardiac output will be compromised. A rapid ventricular rate may require immediate cardioversion. Question number 17. In second degree AV block type 1, the PR interval, option A, varies according to ventricular response rate, option B, progressively lengthens until a QRS complex is dropped, option C, remains constant despite an irregular ventricular rhythm, option D, can't be determined. So what will be the PR interval in a second degree AV block type 1? The right answer: progressively lengthens until QRS complexes drop. The explanation says that progressive lengthening of the PR interval creates an irregular ventricular rhythm with a repeating patterns of group of QRS complexes. Those groups are followed by a dropped beat in which the P wave is then followed by a QRS complex. Move on to question number 18. The treatment of choice for patient with ventricular fibrillation is option A, defibrillation, option B, transesophageal pacing, option C, synchronized cardioversion, option D, digoxin administration. The treatment of choice for a patient with ventricular fibrillation is option A, defibrillation. The rationale is Patients with ventricular fibrillations are in cardiac arrest and requires defibrillation. Question number 19. For a patient with symptomatic bradycardia, appropriate nursing interventions include establishing IV access to administer option A, atropine, B, anticoagulant, C, a calcium channel blocker, D, digoxin. For a patient with symptomatic bradycardia, appropriate nursing intervention include establishing IV access to administer. In bradycardia, we administer atropine because atropine is a standard drug for symptomatic bradycardia. It increases the heart rate. Question number 20. A non-invasive method of evaluating blood flow is option A, Doppler ultrasonography, B, venography, C, angiography, D, cardiac catheterization. So, non-invasive method of evaluating blood flow is option A, Doppler ultrasonography. Question number 21. 20. The rationale. Doppler ultrasonography evaluates blood flow in the arms and legs, major blood vessels, and in the extracranial cerebrovascular system using a handheld transducer. So, it is the best method for examining the blood flow in the arms and legs. It is a non-invasive procedure. Question number 21. Transesophageal echocardiography (TEE) combines with ultrasonography with which other procedure? Option A, electrocardiography, B, endoscopic retrograde cholangiopancreatography, option C, endoscopy, option D, sigmoidoscopy. The right answer is endoscopy. The rationale in TEE, ultrasonography is combined with endoscopy to provide a better view of the heart structure. Move on to question number 22. Serial cardiac markers are monitored in the patient with chest pain for which reason? A. Cardiac markers help in determining if cardiac damage is occurring. Option B. Cardiac markers help identify the area of myocardial damage. Option C. Decreasing cardiac marker level helps clinician estimate the recovery time for the patient with myocardial damage. Option D. Cardiac marker results reveal whether the patient is truly having chest pain. The right answer is option A. Cardiac markers help in determining whether a cardiac damage is occurred or not. The explanation: serum cardiac markers help to indicate whether cardiac damages occur or not. Question number 23. The test that most specific for myocardial damage is option A, CK, B, troponin 1, B, option C, CKMB, option D, myoglobin. The right answer is option B, troponin 1 is the test which is more specific for myocardial damage. Troponin 1 is found only in the myocardium. It's more specific to myocardial damage than any other choices. Question number 24. Which test provides in the best means of standardizing measurement of prothrombin time (PT) to monitor oral anticoagulant therapy? Option A, plasma thrombin time, B, internalized normalized ratio, option C, partial thromboplastin time, option D, activated bleeding time. The test which provides the best means for standardizing measurement prothrombin time to monitor the oral anticoagulant therapy will be option B, international normalized ratio. The explanation: the INR is the best means of standardized measurement of prothrombin time to monitor anticoagulant therapy. Question number 35. Capillary refill time is normally option A 15 seconds, B 7 to 10 seconds, option C 4 to 6 seconds, and D is 1 to 3 seconds. The capillary refill time is normally between 1 to 3 seconds. Capillary refill time that lasts longer than 3 seconds is considered delay and it indicates decreased perfusion. So the normal capillary refill time is between 1 to 3 seconds. When it delayed, it indicates decreased perfusion. Question number 26. When assessing a patient for jugular vein distension, you should position him. Option A, sitting position. B, lying flat on his back. Option C, lying on his back with the head of his bed elevated 30 to 45 degrees. Option C, lying on his left side. So while assessing jugular vein distension, the patient is placed in lying on his back, that is supine position, with the head of his bed elevated to 30 to 45 degrees. Assess jugular vein distension with the patient in semi-fowler's position, head of the bed elevated to 30 to 45 degree. If he lies flat, his veins will be more distended. If he sits upright, his veins will be flat. So we prefer this position. Question number 27. When grading arterial pressure, A 1 plus grade indicates option A bounding pulse, B weak pulse, C increased pulse, D absent pulse. So the A1 plus grade indicates the arterial pulse is increased. Option C increased. The rationale A1 plus pulse indicates weak pulses and can be associated with diminished cardiac perfusion. Question number 28. You are auscultating for heart sounds in a 3-year-old girl, and here on S3 you assess the sound to be a option A normal finding, B probable sign of heart failure, option C possible sign of arterial septal defect, option D probable sign of mitral stenosis. So while auscultating heart sounds of a 3-year-old girl, when we hear S3 sound, it indicates it is a normal finding. The rationale, although S3 can indicate heart failure in an adult, it is a normal in child. Question number 29. When listening to a heart sounds, you can best hear S1 at the option A base of the heart, B apex of the heart, C aortic area, D second intercostal space to the right of the sternum. So the area to listen the auscultate S1 is at the apex of the heart. The S1 is best here at this area, so we auscultate in the apex of the heart. Question number 30. The pressure the ventricle must generate to overcome the higher pressure in the aorta referred to option A stroke volume, B contractility, C preload, D afterload. Which is the pressure generated by the ventricle to overcome the higher pressure in the aorta is called afterload. The rationale afterload is the pressure the ventricle must generate to overcome the higher pressure in the aorta to eject blood out of the heart. Here we come to the end of today's video. Hope you enjoyed. Thanks for watching this. Don't forget to subscribe Satu Cardio 2.0 online nursing channel. For more videos, please wait with our channel. Soon we will update another 30 questions from another system which will be very interesting for you. Take care. Bye bye.